very early, isn't it? People are eating wrong from early. At least when I was growing up, I didn't go drinking Coke or Fanta or anything.
Yeah.
No, I didn't take
Maybe
sugars.
your mom didn't, but
no,
because parents just pumped all of that into their
So
children.
there is so much that is going on, the food. I mean, we had to eat things from the garden.
Yes.
I mean, everybody had a garden. So you just had to go and get something from the garden
to eat.
So, I mean, there were no cars driving you up and down. I mean, there were cars, but, you just had to walk. You had to go outside to play.
Yes.
But all that has really changed. So from childhood, a child is eating wrong, living wrong. People are smoking earlier. People are being exposed to infection, sex earlier. And so they're able to get infections earlier. And so all of this, by the time you pick it up, really, it's not surprising that younger people are coming down with these cancers.
I know that if a lot of people could afford, people will put themselves through the rigors of having to go for some of these tests that would make you know if you're predisposed to it. I've seen celebrities like Angelina Jolie, who was told that she has, and so she had to perform.
Breasts.
But in Africa, in Nigeria, health is very, very, expensive, and also in most cases, people just cannot afford it. So what's the best way, what would you tell people to do in order to guard against or to preventive, methods or ways? What would you advise people to do?
I think when we mentioned the risk factors, the things that are modifiable.
Yes.
Okay, the modifiable ones I talk about the what you're consuming. How healthy are you living? What are you eating? But beyond that, my emphasis, as a breast radiologist, is that we want people to go for screening. Okay. We want people to be able to look at their breasts. For a woman, go beyond your beautiful face.
Yes.
Go beyond the tiny pimple. And actually notice what is going on in the breast. So if you're able to know what your breast looks like, what it feels like, now, if you notice something going wrong, then you'll be able to come to the hospital. Of course, you say things are expensive, but in the long run, the treatment could be much more expensive. Yeah, if it's found late, because finding a cancer early means that 90% of the case, the patient is going to be okay in 5 years' time. Yeah, is healed, is normal. Like our survivor here. Mrs. Yemisi, she should be in a position to tell us exactly how she went through cancer and survived. 24 years later, she is very much here, and because it was picked up early. The interesting thing, if you have a nice dress or suit and they say dry clean only, you're not going to pop it into the washing machine. No, you take it to the dry cleaners, and yet it's expensive. So it's all about how do we appreciate our bodies, because we always say hospitals are expensive, and yet we end up buying expensive clothing, expensive shoes, we wear the gele, we go for parties, and yet it is much cheaper to do this test in the hospital. So I still would encourage that maybe once in a year, do a checkup. The way you do, you don't wait for your car to break down, do you? No, you don't. You still send it for a check. So once in a year, we can have a checkup and see, let's see what is going on. And then beyond that, in our own areas, we can actually do like a breast examination by ourselves. Yeah. Okay.
For ladies, right?
For a lady, you must learn how to do breast self-examination. Yeah. Okay. And when you do that, you can also do clinical. That's in the hospital. So really, the bottom line is like, how do you really care for your body? It's your body is irreplaceable. There's nothing else. If you don't have it, you don't have it. So it's irreplaceable. So you need to take care for your body.
Let me ask you something, right? I know this might not be even related to what we're talking about, but then it's something that's been coming to my mind. I feel I just need to, get out with it. Ladies these days are fond of going to places for skin, they inject them with some glutathione, they do a lot of laser treatment, a lot of stuff. Those sort of things, do they also contribute in any way to your health, being at risk in any way? I just thought to put that out.
Of course they are.
Because people spend a lot on those kind of things.
Oh, everything that is not natural can be a risk, all right? But we always depend on evidence-based medicine.
Yeah.
And so it's all about research. If the research is linking, what they're doing to cancers, we say yes. If they're not, then we just leave it alone. But the thing is that a lot of the things they do on the skin, I've seen, this is aside from breast cancer, one of my patients, male patient, she came down with a renal kidney disease. Mm-hmm. I had to ask, do you use bleaching cream? I mean, when I saw the patches on his skin, I knew he was using something before because I could see things on his skin. You use bleaching cream? Oh, yes, he used it for quite a while. I mean, so all of this will eventually, it's all chemical. So eventually something would go wrong, but not specifically for breast cancer.
Okay, I just thought to bring that in. Now, when you were, when we're introducing and all of that, you said something about the fact that it's majority women, and in some instances, some men.
Yes.
Tell us how that happens in men, breast cancer.
The men still have breast tissue.
Okay.
And so the breast cancer starts within the milk. You can have them starting with the area of the breast that forms the milk, but majority of it will come from the tubules, like the ducts.
Okay.
When the milk is produced, it goes through like a pipe for it to get to the nipple.
Okay.
And so a lot of the breast cancer will come from that pipe area. All right? It's just that men also have that. It's just that the woman, it's more developed than the males. So it's basically the same thing. Unfortunately, because the males don't know that men can also have breast cancer, they never show up. I mean, the ones I've had always came in late.
Wow.
Yes, because they think it's a female affair.
Yes.
You are the one that has a breast, you are the one that has a breast cancer. No, it's not that way. Anyone at all that has breast tissue, especially when the breast tissue is already developed, can end up with the breast cancer.
So the men should also submit themselves for examination as much as the women, and then also that breast examination for the men too? No,
normally it's not part of the guideline for the men to do breast self-examination. Again, if a man has something in a lump, they should be able to notice it because the breast is hardly there.
Yes.
And so if there's a lump, they'll notice. Okay, so it's easier for a man to notice. But for the woman, because the breast is developed, and the cancer can be hidden. And that's why we say you need to learn what your breast looks like, what it feels like, and so that when there's any abnormality, then you can come in to hospital early.
Wow. Are there chances of survival? Like, what's the survival ratio for, breast cancer victims? In your experience?
Now, for those that come in early, so when we talk about early, we're looking at maybe a lump or disease that is probably less than 2 cm, maybe the size of a palm kernel. Yeah, something small. A lot of the time, at that stage, it hasn't spread.
Okay.
And so when it has not spread, then the chances for survival. So according to research, like up to 90% when they come into that early stage are able to survive. So, but unfortunately, like up to 70-80% of our patients are going to come in when it's spread. Because of, different reasons. They didn't notice it, they noticed it and decided, living in denial. They just outright, it's not my portion, and they don't show up. And so they end up coming in late.
Yes.
But if people can come in early, then the chances for survival, because really medicine has advanced quite a lot. And the interesting thing is that the person doesn't even have to lose the breast. Because a lot of the time it's like, don't touch my breast, and I want to cut my breast off. But it's not about cutting the breast off anymore, because when they're tiny, it can't actually be removed without the woman cutting her breast off, depending on the type. And then there are all, reconstructions and all that going on. Medicine has advanced quite a bit. And so the treatment options are really available. And so it's just left for the person to come in early, and then all of that can be applied.
What are the chances of a reoccurrence, in a case where you are able to successfully treat, whether at the very early stage or maybe at an advanced stage, reoccurrence? I keep hearing that. I lost a neighbor recently, based on a reoccurrence
of a breast cancer.
Yes.
Yes, it can recur, but just very few cases. Now, some of the time it recurs maybe because it wasn't removed very well.
Okay.
Yes, so maybe the margin.
Okay.
It's not just, it wasn't removed very well, and then it can recur.
Okay.
So this usually the cause of reoccurrence. But then sometimes it just simply reoccurs. Yeah.
Without any explanation. Wow.
But like I said, it's luckily very very tiny
Yes.
number of people recall. Most other people should be able to do well if it's well treated.
Okay, so sorry, I'll still come to you, Mrs. MEC. But this screening thing, tell us about it. Like, what's the procedure like? Because you said apart from self-examination, you need to submit yourself to the hospital for screening too. What does it take to screen?
Yeah. The screening, we are in Nigeria. We're using the American guidelines, okay, for screening. And so what we're using for screening is usually mammograms. Mammograms are special X-rays just for the breast.
Okay.
Okay. And then we can also do ultrasound, breast ultrasound. Those ones are common. The machines are common in most places.
Yeah.
And so usually we start from 40 years to do our screening, mammograms.
Okay.
So we can screen yearly, twice in every 2 years.
Twice in every 2 years.
On to the person is about 70 to 75, depending on if the person wants to continue with the screening. And so for people that are less than 40, and the reason we do that is that the breast tissue is still kind of young, still producing milk. And so when they're less than 40, we tend to go with ultrasound. You know? Yes, in developed countries, they don't believe that ultrasound should be used for screening, but then we have to find something that works for us in our environment. So the ultrasound is good for us. We found out that it works well, and then it's available in most places.
Okay.
And so people that are less than 40 can always come in and have a breast ultrasound done.
Okay, all right, interesting. So that means people who are less than 40 should not submit themselves for a mammogram.
Not
Is there any
necessarily.
risk associated with that? Because
yeah, there have been studies that say there is a risk. You know, there's a risk of cancer because it's radiation. Radiation generally, okay? But then the radiation to the breast, the machine is really small. And so that's what they're saying, that there's not much. So we don't, there's not enough evidence to say you should not. And for everything that you do, you always have to weigh risk, the benefit.
Yes.
That's just what life is about. And then we find out that the benefit far outweighs any risk. Yes.
All right. Guys, we're streaming live on YouTube and Facebook. You can join us. You can drop questions and messages, and we'll attend to that in a bit. I have Dr. Amaka in the studio with us, and I also have a cancer survivor. We should give you a shekere. Mrs. Yemisi Daudu, good to see you.
Thank you so much for having me.
You're a symbol of hope for people, and it's important we get to hear your story. Tell us about your story.
Thank you. About almost over 24 years ago, I was living my normal life. You know, going after my business, my family, my children, and, you know, all of a sudden, I realized that I was having diarrhea. Diarrhea, yes. Loose stool. So I went to the doctor to tell the doctor, and the doctor gave me Imodium.
Okay.
And I took the Imodium for about a week or so, and the diarrhea stopped. Then afterwards, it came again. But this time, it was with a bit of...
More news and...
Okay, sorry. Let's just quickly take this commercial, then you continue your story. All right, guys, we'll take this, and we're back before you know it. Stay with us.
360.
Sunny Side with Swat.
This is Sunny Side on 95.1 Nigeria Info.
All right, thank you so much for staying here. 26 minutes past 1, and we're talking with Mrs. Daudu, who's telling us her story on how she is a cancer survivor, or has been a cancer survivor for 24 years. Ma'am, you were saying that the second diarrhea came again this time around.
Yes, this time around,
Yeah.
it came with blood.
Blood.
Yes. And it got to a stage that it was just plain blood.
Wow.
So I knew that something, was going on there. So I went to the hospital. And the doctor said, she's going to take some series of tests to detect what was happening. So I was in the hospital for about a week or so. And eventually the doctor came to me and said to me that, sorry, they have taken, series of tests, and they realized that I have cancer of the colon. And my life just went down.
I can imagine.
Because then, many years ago, it's not like
now.
Now your doctors will explain things to you. Even your family members that have gone through it, they will tell you this, that. But then, it wasn't like that.
Sorry, but prior to then, right?
Yeah.
Did anybody in your family have cancer?
No.
Wow.
No, not at all.
Okay.
Yeah. So the doctor said to me that it's cancer of the colon. The growth is about almost 20 centimeters. Yes. And that, he needs to operate. Take it off immediately and start treatment. If not,
it might just deteriorate.
Yes. So, something like that. In Nigeria, when you see somebody having cancer, you'll be looking at somebody that is going to die soon.
Exactly. That's just it. Death sentence.
Death sentence immediately.
Yes.
So that was what was on my mind, that, oh my God, how did I come to this stage? I asked the doctor, what was I doing? What was I eating? I was so agitated. And the doctor said, sorry, I cannot tell you that this is the reason, this is why you have cancer.
Yeah.
All I can tell you is that you have cancer of the colon. It is 20 centimeters, and I have to take it off. If not, you will die. And then I started crying, thinking about my children, my husband, my family, and all this. Am I going to leave them like this? I was so young. I was just over 40 then. And the oncologist called me and said to me that, she knows that I can survive it. That I should not think about people that are dying. I should have a positive mind, that he will support me in every way that she could, that she knows that I will survive it. So with that, the support of my medical team, with God, having a positive mind, because I'm Christian and I believe in God. So with my faith, with the support of my medical team and my family, my husband, my sister, my children and everyone, they supported me. So I was able to go through the operation and through the treatment, and here am I today, surviving cancer.
Amazing.
For over 24 years.
So since that operation, the treatment, what has been the routine right now, like in terms of checks again, lifestyle, and every other changes you've had to make, ever since being treated of cancer and surviving?
Yes. Then it was not something that you will have and you will forget about it. No. It was something that has to do with what you have to do, the type of treatment, the type of healing. So then I had the operation.
Yes.
I had the chemo. I had about 24 chemotherapy. Yes, session.
Wow.
It was really, really bad. and my hair fell off. My skin turned black, which they have told me about.
Yes.
And so many things, the pains and all this. And eventually, I got into depression. It was deep, chronic depression.
Wow.
Yes, and my mind was as if, I will not make it.
Yes.
Then I went to see the psychiatric doctor because I wasn't being able to do normal things, to eat, to say I want to cook, to say I want to have a bath, to say I want to. It was deep depression because of my state of mind. Because all the time I was thinking that I will not make it.
Oh, okay.
Yes.
Okay.
So the state of mind is very, very important in people having cancer, being diagnosed with cancer. It is important. Yes. Because even if you are having the best of treatment and your mind is negative, that I can't make it, maybe the person will not make it. So when you are having cancer, it's important to have a good state of mind, a positive mind that, yes, I will make it. With the help of God, with the support of my family, of my medical team, I will make it.
Yeah, indeed.
And the person
I like the fact that you mentioned something very important here about the fact that you're a Christian, but you submitted yourself for treatment.
Yes,
there's some people who always use this card of faith and say, well, I'm going to faith it. If your faith is not strong enough, please go and treat yourself. Keep having the faith. It doesn't change anything. But you submitted yourself for treatment, and that's why you're here to tell your story today. And I think it's very important. But have you been going back for checks and any other things since then?
Yes, I did a check 5 years after I was given all clear.
Wow, congratulations.
All
Congratulations.
all
right, interesting. Doctor, she said something about the state of mind. Not too long ago, I think some 2-3 weeks back, someone sent me a message about, having discovered that he was with someone that has HIV, and all of a sudden, because of the fear, the symptoms started manifesting. He has ED, he has this and that. He mentioned a lot of things that he's going through, and he said he has gone to do the check, and the first came out negative, and then they told him to come back for another one and stuff like that. So that means some of these things sometimes are tied to the mind. Am I right or wrong?
You are absolutely right. Fear.
Yes.
Fear is a killer. First.
Yes.
I mean, if you're going to go through treatment of any kind, as a doctor, realize that the people that actually do better treatment of any kind are the ones that have hope. People that have faith, people that believe that they can make it.
Yeah.
But once someone becomes depressed, the entire system changes. And that's why it's absolutely important, like you said, that you have that support. And so what I do for my patients is that I make sure that somehow they're my friends, that they can call me, that we can talk, that I can give them a hug and tell them you're going to be okay.
Wow.
So I even had a patient this morning. Just before I came out, she called to say I'm going through chemotherapy and all of that. And I encouraged her, okay, I need you to do this and I need you to do that. And most importantly, from what Mrs. Yem said, they have a group.
Okay, support group.
A support group.
Oh, nice.
Which was not there before. And so what they do in the support group, it's an amazing work that they're doing. And so what I do is I actually send my patients to them. Because, there is no way I can take care of all of that.
No,
it's not even possible.
Definitely.
And so you need to, it's like treatment of cancer is multidisciplinary. It's not one person. It's like a team. You have a nutritionist, you have the oncologist, you have the doctors, you have the nurses, you have pain, those that manage pain, you have the psychologist. And so all these people come together, and that's why she had the best of care, because she had all the support. And so their group, it's something that I'm really excited about. I just found it out last month. That was this group. And so I'm just sending my patient, once I just send them there, because I realized that talking with my patient, did you contact them? Yes, they did. I see a set of patients that are eager to take the treatment, and they have a lot of hope.
Yeah.
in the process of the treatment. And so although they're going through chemotherapy and all of that, I can still see something in them that was not in a patient that I had previously.
Yeah.
And so it's absolutely important that the person's state of mind should be actually stable and positive. Yeah.
Ms. Yamisi, what do you people do in the group, to support other, whether patients or survivors? What you guys do?
Thank you. The group is called NEPISIN.
Okay.
It is network of people impacted by cancer in Nigeria.
In Nigeria.
Not only in Abuja or Lagos or wherever.
Everywhere
In Nigeria. So anybody that has been diagnosed to have cancer or even survivors can be in that group. And it's an umbrella body designed to support everyone who has experienced the scourge of cancer. The burden of cancer is so huge, it does not only impact patients, but the society at large. The family will be affected, the children will be affected, parents will be affected. So it's something that, is huge. This network seeks to embrace people impacted by all kinds of cancer, irrespective of gender, location, status, or age. So everyone is welcome.
Yeah.
Then, NEPISIN boasts of a support group of over 200 champions.
Okay.
Yes. From all over Nigeria. And host support group meetings where these champions interact with professionals and encourage each other. So say somebody that has just been diagnosed, that's as my doctor said,
Yes.
that she sends them to a platform.
Yes, I do.
When you come in, you tell us about yourself, about the type of cancer you are having, about the level where it is, and what type of treatment you are taking.
Yes.
And you have a lot of people on that platform that can tell you that maybe if you call in that, I just had my chemo today and I'm not feeling well, I'm having these symptoms, that symptoms, one of us or many of us will be able to say, oh yes, it can happen to you. I felt it myself, but this was what I did, drink a lot of water, try and relax, something like so it will make people's mind to be at rest. That I have people that are going through what I am going through, or that have gone through what I've gone through. Then years back, there was no group like this.
Honestly.
So we need to send kudos to NEPISIN for what God is using this group to do. It's not easy, especially in Nigeria. It's not easy at all. But when you have somebody or people like yourself that you can reach out to.
Yes.
And
makes all the difference.
I mean, this applies to almost every area of your life. Once you have that support,
Exactly.
it comes in. It just comes in so handy. And I mean, listening to stories of people like you, seeing you alive 24 years after is something that can make someone say, "Oh my God, she survived, so I can also do it." And that's just keeps you going and stuff. We're really glad that we're having this conversation for people who might have been diagnosed with cancer or who are going through the motion of treating it and all of that. There is hope for you. I mean, it doesn't mean that it's a death, sentence. I mean, you can hear it from one who is alive 24 years after, and from Dr. Amaka, who is also telling us her own experience with treating this for the longest of time. Okay, so if you have questions, if you have comments, you want to chip in, my intern here has a question for you. She sent me, I said, ask yourself.
Good afternoon.
Hello.
I just
Speak to the mic.
I would like to know how the symptoms and how to self-check, like the proper way to self. Because most times you just hear people saying press this, then you feel, then the symptoms of maybe when you wake up and stuff, you feel this way, like how.
Okay, that's really important because you need to know what you're looking out for. And so, the symptoms, usually it's like, there might not even be anything that you notice, except you don't check, all right? And so that's why it's important for you to check. And so the commonest thing is it comes in as a lump within the breast. But then if the lump is small, you might not notice it if you don't check. And that's why I say we need to check. And so it comes in as a lump. it could be a nipple discharge, something from the nipple that is bloody. Okay, it could be a bloody nipple discharge, or it could be a change in the size. I mean, the breasts are never really the same size, but when one is obviously much larger than another, okay, and then it could be a change in the texture of the skin. The skin changes color, or the skin becomes thickened. Then it's something to worry about. Or you look at the nipple area and then it looks like an eczema within the nipple. You know, so sometimes people end up going to the chemist and giving them Demovit and all of that. No. You have to come to the hospital because that is usually a sign of breast cancer. However, 80% of lumps in the breast are going to be benign. In other words, they're not going to be cancers. And so you might not know the difference, and that's why it's absolutely important that you come and check. Now, as a lady, by the time you start menstruating, you need to start checking yourself. And how do you do that? Normally, you take maybe a week after your period. You know, after that, your breast is not too heavy, it's not painful. And then what you do is that you stand in front of the mirror, you put your hand at your waist, all right, and you bend down a little bit. And when you do that, your breast should be hanging. So you check and make sure that they're the same, that you're not looking at anywhere that is being pulled up. Because sometimes the nipple can go inside. The nipple is pulled inside, and so that is a problem if it had not been like that before. And then when you're done with that, you put one hand on top of your head, behind your head, and then using the other hand, you just feel around your breast. Your fingers should be flat. So using your fingers, you just feel around the breast in a circular pattern. And then you feel up and down. And then you go around the nipple. You feel it also. You press your nipple just a little bit to see if there's anything that will come out. Sometimes milk comes out. It's not usually a sign of cancer. And then you look at your armpit too and make sure that there is no lump, because sometimes the lump actually stays in the armpit. And so you try to do that like once every month. So it's something that you have to, it's a habit that you have to form.
Yeah.
And once you form that as a habit, you find out that it's something that you just do without even thinking about it. And if you notice anything, you definitely need to see a doctor. Like I said, 80% are probably going to be benign anyway, but you can't make that diagnosis by yourself.
You have to go to the
You have to have it tested.
Okay.
All right?
Thank you.
All right.
All right. We have someone here. Hello.
Hello, Swat. This is Wanda from Jabi. Good afternoon.
Good afternoon. Welcome.
Yeah, is cancer curable? Is it cancer curable and is it hereditary?
Come again.
Those are my questions.
Come again.
Is it cancer curable?
Okay. Is cancer curable and what else?
And is it hereditary?
Okay. Is it hereditary? Okay.
Yeah.
Okay. Oh, okay. Go ahead.
Okay, yes, cancer is curable when we pick it up early.
Yes.
All right? If you pick it up early, it's curable. And hereditary, yes. People that have had breast cancer before in a family, the female, like if a mother has had breast cancer or a sister, we tend to pay more attention because the person might have it. But the interesting thing is that most of my patients don't even have a family history.
Does that mean the dynamics are changing or something?
They have to be, I talk about evidence. Medicine is all about evidence, and except we have our own research to back up what is going on.
Yes, you said
and that's why I say that, abroad, in developed countries, I went for a course, and you mean you use ultrasound for... Yes, I do use ultrasound. That's what is peculiar in my environment.
Yeah.
So we need to find out what works for us. And that's why we're leaning more towards ultrasound instead of mammograms.
Okay, we have
For
someone
younger
here.
people.
Hello.
Hello.
Good afternoon.
Good afternoon. My name is Vivi. I'm calling from Iraqi.
All right, go ahead, V.
Yeah, I want to ask a question. If you have a silicone bone, can you still have a cancer?
If you have a what?
Silicone.
Okay, silicone.
Yeah.
Is that all?
Yeah.
All right, then. Doctor will answer you. Just keep listening.
Silicone, if your breast tissue is still there, then you can always have a breast cancer.
Could that be the catalyst?
No, not really. We haven't found anything to link silicone to breast cancer. So, I wouldn't call it. It's not known as a risk factor.
Okay.
Yes, but a lot of people use silicone because they want to augment the breast size. So, yes, they can always have cancer with. I've seen quite a few, actually.
All right, more people on the line. Hello. Hello.
Hello.
Yes, good afternoon.
Yeah, good afternoon, ma'am.
You're welcome, sir. Go ahead.
Yeah, it is. But to give from people, I want to greet our guest here. God call it to bless you in Jesus' name. My mom happened to be a survivor of breast cancer. That was about 5 to 6 years ago, if I'm right. And she's doing well today. My question happened to be what are they doing to carry those women at the rural area, very remote area, along? And those spiritual women that always cover their heads with the blood of Jesus, they will not do the right thing. I'm a pastor, I'm not against the blood of Jesus. But I think we need to do the right thing, go for checkup as I will posted earlier. So how are they doing to carry our religious people and those people in the rural area, how are they doing to carry them out? Lastly, like somebody like my mom, when she went through the treatment, I think her breast was shut off, which was feeling bad about it. We were trying to encourage her. So what are they doing? Is there any hope for any woman like that her breast has been off? And what are they doing to encourage them to be able to come out boldly to encourage those that are still living under the fear? Thank you so much, Pastor TJ from Dubai.
All right, thank you, Pastor TJ. Pastor, Doctor, you want to answer that?
Okay, that really is. And first of all, I have to say congratulations to your mom for going through the treatment and survive and being here with you. Yes, we do have problems. The sheer number of the population, it always is a problem because when you're trying to get to people in the rural areas, you're not really able to. And so what we're doing now is part of it.
Yeah.
Because with the media, you can get anywhere, okay? And so the places that I can't go to, the radio station is able to gather, and so these women will know it. And so we're also thinking of, training doctors, nurses, health workers in the rural areas to be able to detect these things, so if they know what to pick up, then when they do that, then of course they can refer their patients to the tertiary health centers. That is a challenge, I must say. I can't honestly say that it's that easy, but these are the things that we're working towards. We're also trying to create awareness in churches and mosques, in religious houses. Because the truth is that that is such a challenge, not my portion. People are in denial, and they refuse to take treatment. And there's honestly nothing you can do about it. I am happy that you're a pastor, and so you can educate your members.
Yes.
And so what we do, I've had so many different times I've been to churches just to educate them that taking care of yourself, it's not a lack of faith. In fact, it's God expects you to take care of your body because you don't have any other one. And so, that's it. And for your mom, like I mentioned, treatment is dynamic and it's advanced a lot. People can always have a breast reconstruction surgery. They can have implants if they want. It's very common now to have implants, breast implants. So someone having the breast off doesn't mean that they have to have it off, looking like that. They can always have an implant. And then there's always a minimum breast reconstruction surgeries where a part of the body is removed to form another breast. I mean, these are the things that going on in advanced countries, but are coming down to Nigeria. So there is a whole lot of treatment options that are available at the moment.
Okay, thank you so much. Let's read some messages on the WhatsApp. This one says, "Good afternoon. Please, someone said that sucking the breast reduces the risk of breast cancer. How true is this?" Moses Anjaku is asking that. Meanwhile, V from Kubwa said, "Good afternoon, ma'am. Swat, I greet the wonderful women in the studio. Please, where can we do these checks and test?" That's another. Do you have a bio, doc, so you can just write some of them? Then also, Geronimo from Duse Alaji said, "Can breast cancer be misdiagnosed if a breast has undergone an incision biopsy? And can wrong histology results from breast biopsy also lead to an IHC that reads as triple negative?" This guy seems to be in the medical world. I don't even know what you're talking about. Anyways, but I'm sure doctor knows, so she would respond to that. Good afternoon, SWAT. I think it would be a good idea for this medical team to create awareness in churches and mosques. It's very important and very crucial so that they will not be living in ignorance, or people will not be living in ignorance. Dave from Kubwa opines that. I guess the doctor says they're doing that already, and I'm sure they will continue. Pastor TJ says his mom is 82 now, though. I mean, that's very good. That's really good.
That's awesome.
Good day, Swat and Co. There's a general saying that when breast is being sucked frequent. Oh, this is another one again, Mr. Ono Agba Lucia. Don't worry, that will be answered in a bit. Good afternoon, Swat and the guests. Great conversation out there. Wow, I like the encouragement from the guests. Kudos to all of you. Thank you so much. And I guess that's it. Personally, I'm not comfortable with the vaccines, but those rolling those vaccines are... Which vaccines are you talking about? This is not for us. Anyway, somebody's here. Hello. All right. It did not stay. Okay, Doc, you might want to just start responding to some of them.
All right. It's twice. So we're talking about sucking the breast. I
Yes.
think we're more into like breastfeeding, the risk factors. You know, those that have not breastfed are more likely to have breast cancer than those that have breastfed the children. So not necessarily sucking breast for the sake of
Sucking breast.
These are men that are asking for the...
Yes, so...
yeah. So it's not about the sucking the breast itself, but it's about breastfeeding.
Oh, okay.
You know. But then I must say that there are, again, really tiny risks. And again, we talk about risk factors, but I've had patients that don't have any of that. Okay? I've had patients that don't have any of that. So people that have not had children before, people that have not breastfed, people that had very early menopause, later menopause, and early menarche, that's the beginning of a period. You know, children are having periods at 9 years, 10 years, unlike before when it was 14 to 16. So we're having early. And so there's a lot of time for estrogen to do its thing.
Wow.
And so these are all the risk factors that, you know, that we have noticed that have been associated with breast cancer.
Yeah.
The screening can be done first. You start with your own breast self-examination. It can be done in your home anytime. And so if you're up to 40, you can have your screening done in the hospitals. We have machines in different places. I'm working in University of Abuja Teaching Hospital. We have a machine there, in National Hospital, and quite a number of private places in Abuja. If you're calling from Abuja, there are quite a number of places that have it. Ultrasound is basically a lot of centers have ultrasound, so you can always have your screening done in those areas. So someone talked about wrong histology report, you know, and IH and triple negatives. Yes, unfortunately, sometimes you can have a misdiagnosis. So you can have a misdiagnosis. However, if you're being treated by a team, you know, I talked about a multidisciplinary team. It's not one person treating. I don't advocate, I work in a teaching hospital. I do not advocate one person treating cancer of any sort. No, I don't. And so what I do is that if I do a biopsy, I've done a test, the surgeon has done a clinical examination, they sent to me, I've done my ultrasound, I've done my mammogram, I've done my biopsy, and I think it looks like cancer. Result comes out and says it's not. I'm not likely going to accept that result. We're going to send it back to the team meeting, and the team will say, we don't think so. You know what? Maybe we'll repeat this.
Repeat the test again. Let's quickly just we'll take a quick commercial, and then when we come back, we'll have some more before we round up on our discussion. It's 1:55, 95.1 Nigeria Info.